Hello and welcome to YouTube channel HealthQ, the place where my mission is to not only motivate you but help you to move on to the brighter side of the health. In today's video, as we are doing a series on chronic pain, we are going to understand how and why chronic pain impacts your life. What exactly happens? Why do you feel this chronic pain? We are going to understand that in a very simple language. So if you are someone who is thinking or wondering why I am in pain constantly or always, this video will make you understand what is happening inside your body. So let's begin. Friends, life without chronic pain sounds very appealing, isn't it? Just imagine if there was no pain at all. Especially for someone who is right now suffering from chronic pain, if that person thinks, what if there was no existence of pain at all? Life would have been so beautiful. But unfortunately, this pain is lifesaver for us as well. Imagine if this pain sensation was not there for you. You would not be able to protect yourself from some harmful things that are present in our environment. You would never be able to pull your hands away from a fire or as something which is pounding again and again, isn't it? So yes, pain is a protective mechanism. God has given the ability to experience pain so that we can protect ourselves from this environment, from this nature and the dangerous situations. But sometimes this pain gets over on our head and could cause damage. When I'm saying it gets over to our head, I'm not meaning to say that I'm talking about your psychological issue. What I'm trying to say is, what if this pain gets uncontrollable? What if this pain is just not stopping? What if this pain is impacting your quality of life or day-to-day life? Then it's absolutely a problem, and then it's absolutely important to address that. And this is what happens for someone who is suffering from chronic pain, a pain which has been there for more than 3 months. No matter what you try, what you do, this pain doesn't go. That person feels sometimes disabled, sometimes anxious, sometimes helpless, and sometimes clueless. So it's important at first place to identify and know what exactly is this chronic pain, from where it comes from. So the entire idea of this video is to make you understand that. Friends, as I said, our body is controlled by that CPU, which is our head, or else you can say brain. This brain helps us to perceive and feel pain and also to react pain. So whenever there is a stimulus which is present outside, which activates your pain carrying nerve, your brain will catch that message. And in reaction, in answer to it, it will give a response. This response or reaction could be pulling yourself away, or else holding yourself strongly, or else even keeping your hand on the area of pain, and even sometimes crying. All of these are responses that our body give, or as reaction that our body give to the pain sensation. Why this pain happens is due to a lot of reasons, but mostly there is a disruption in the biomechanical level. There are something called as nociceptors which are present in our body. Nociceptors are also called as neuroreceptors, or as nerve cells which are especially designed to pick pain sensation. These nociceptors passes via nerves to your spinal cord and to your brain. These nociceptors are those messengers which carry your pain sensation, and that's how you feel the pain. So this is what exactly happens when we feel pain. But there are different places from where this pain comes from. Sometimes this pain is a muscular pain, especially when your muscles is tired or is strained, or else has just gone through some pull or abnormal strain. At that point you will experience something called as muscular pain. Sometimes the pain is due to inflammation. If your joints, your muscles have gone through some injury which has caused inflammation in that area, at that time also you will experience pain. Sometimes the pain would be coming from your nerves. Let's say if you are a diabetic and your nerve has been damaged, so your nerve pathway has been impacted, and even a smaller movement will irritate that nerve and will give you the pain sensation. And sometimes the pain is a neuroplastic pain. The brain, which is actually the cause behind your chronic pain, where your brain has become oversensitized, overstimulated to those repeated pain sensations that you have experienced from a very long period of time. Now, physically, there is not much problem that is present on your muscle, but the problem is now lying inside the brain. I don't mean that you have gone mad or you have some mental issues. No, not at all. You're absolutely fine. But it's just that your brain is perceiving your pain way more than it is supposed to do. And that is what is neuroplastic pain. That's why you must have seen or heard many people saying, I did an x-ray, I went to doctor did entire checkup, all the reports looks fine, nothing is problematic, but still I am in pain. I constantly feel pain. What has happened at this stage? This stage, your brain has become overactive. Your brain is over responsive to even a smaller stimuli, which was an absolutely normal thing before. And that's what is neuroplastic pain. This neuroplastic pain is one of the biggest reasons for all kind of chronic pain that people experience these days. So what exactly happens in this neuroplastic pain? Your pain leaves a memory. Whenever there is an experience of pain, that experience is stored in the brain, and brain uses this memory, this experience, whenever there is a similar episode happening. So just imagine if you experienced back pain once. Let's say this back pain was a little more tensed, it was more longer than usual. At that time, you experience pain for a very consecutive period of time, let's say 5 days, 6 days, 7 days. Every single day was difficult for you, and those things was constantly being registered in your brain as a memory. This memory has now been part of your subconscious mind. And now what will happen? Whenever you will develop some another injury, some another inflammation in future, your brain's memory will activate. Your brain's subconscious experiences gets activated, which starts giving sign that this looks like that similar situation that came previously. I need to protect myself, I need to guard myself, and your muscles will go into more spasm. Psychologically also, you will be scared. You will feel that, oh my god, I'm going to go into that same pain again. I'm going to go through something very severe. All these emotions, all this negativity will manifest in your body in the form of tightness, in the form of stiffness, and in the form of pain. And that's what exactly happens. And just imagine if this thing is happening again and again and again, what would be the physical manifestation of all of these? Muscle tightness, muscle stiffness, difficulty in doing your day-to-day chores, and even sometimes lots and lots of functional limitations. So now the pain, which was just a simple muscular pain, has now taken a long path and has become a chronic pain. And that's what exactly happens with most of people. But the good news is, this chronic pain can be reversed, because at the end of the day, our brain is plastic. You can change the patterns, the memories, and the experiences on it. You can retrain your brain again. Hence, it's important to work on your chronic pain and not to ignore them. In our coming video, we would be talking more in detail about these chronic pain and especially what we can do to get rid of this chronic pain. So make sure to stay tuned with me on this video. Thank you.